What is ADHD? ADHD stands for Attention Deficit Hyperactivity Disorder. Someone who is diagnosed with ADHD can be easily distracted, have behavior that is impulsive or disruptive, and have trouble staying focused. With the help of ADHD medication, these issues can be solved or at least improved. The exact cause of ADHD is unknown. However, there are several factors that are thought to play a role in causing one to have ADHD. The first is genetics. ADHD runs throughout a family. Anywhere from 1/3 to 1/2 of parents with ADHD will have children who also have ADHD. Children's parents who have ADHD have a 50% chance of also having ADHD. And children with siblings who have ADHD have a 30% chance of having ADHD also. ADHD can also result from pregnancy problems. Babies who are born premature, have a low birth weight, or whose mother had a difficult time in their pregnancy all have higher chances of having ADHD. Children who have head injuries to the frontal lobe can also have a higher risk of having ADHD. Pregnant women who smoke or drink alcohol also have a higher risk of having a child with ADHD. ADHD medication typically works by increasing the amount of neurotransmitters dopamine and norepinephrine in the brain. There are two types of ADHD medications, stimulant and non-stimulant. Depending on the person and their specific characteristics, one will either be prescribed a stimulant, a non-stimulant drug, or even both. Currently, there are 29 different stimulant drugs that have been approved. Stimulant drugs come in two forms, immediate release and extended release, and they either are in a pill, a capsule, a liquid, or a skin patch, and they have lasting effects for 4 to 12 hours. Out of the 29 types of stimulant drugs, these are the most common. Stimulants do not work for around 20 to 30% of people with ADHD. Those 20 to 30% of people then move on from stimulants to non-stimulant drugs. Unlike stimulant drugs, non-stimulant drugs can last up to 24 hours. Unlike stimulant drugs, there are a few types of non-stimulant drugs. These are the two most common. State of the art. Although some psychiatrists may abuse their ability to prescribe ADHD medications, an informal distribution of these medications is also common. These meds are still at a point where they are primarily being used to treat attention deficit disorders. The near future developments of ADHD meds. As technology advances, access to human advancements will be rampant. One aspect of this is advancement of physical prosthetics. However, psychotropic drugs, specifically ADHD, are likely to become more commonly used by people who are not intending to improve a learning disorder, but rather to enhance their thinking process and focus past their natural abilities. ADHD medication faces several obstacles. The first being the fact that the long-term effects one who takes ADHD medication may have are unknown. While some doctors and researchers have some idea of some long-term effects one might have, there are still many others that our society may not know. One example of a long-term effect that researchers and scientists believe to be true is a study that was conducted that showed children who take ADHD medication for a long period of time showed issues with their developing brains being able to adapt to new situations, along with the possibility of having increased risk for addictive behavior. Aside from long-term effects being undetermined, the use of this medication may also raise moral issues in society as research and technology develops. For example, in competitive scenarios, especially adolescents, they may feel inferior to their peers who have been given access to ADHD medication and are able to thrive and work in classes. Due to the fact that ADHD medication enhances one's ability to perform tasks, the possibility for students and adults with ADHD to start abusing these medications is very high. A common belief in today's society is that those who are taking medication for ADHD have an advantage over those who are not. People feel that if someone who is taking ADHD medication and is successful or making good grades, then it is because of the medication and not the person. This can lead to the misuse of ADHD medication. People without ADHD will have the desire to take enhancement drugs so that they can improve their abilities, just like those who already take medication. Soon later, taking ADHD medications will be normalized, and those who do not take enhancement drugs will look inferior to those who are taking the drugs. This is an example of how ADHD medication can be a harm to human relationships with friends and everyone in general.